Hi, and welcome to the PIERS Association podcast. We're interviewing Dr. Jeff States, who is the founder of Personal Injury Training Institute, and he's been working with personal injury and chiropractic for a little while. Welcome to our podcast, Dr. States.
Thank you. Glad to be here.
So I've got lots of questions for you because you know about everything there is to know about personal injury. But let's start with something simple. What's one thing a chiropractic physician can do to be better at personal injury?
Get trained. That's really the bottom line. There's so much information. And of course, I've been sharing this for decades, since '96, to help chiropractic physicians, doctors, and attorneys all work together doing a better job to help the patient heal better and, to get a better outcome in the litigation. And if you're not trained, saying the right things, writing the right things, doing the right things at the right time, the outcome will not be as great. And so training is the most important thing that a doctor needs to get to be better at it, because you didn't get any in chiropractic university.
Yes. What's one skill that a chiropractor could acquire that would make a big difference?
Well, that's a difficult question, but I'm going to start with assuming you're a great adjuster and a great clinician and a great diagnostician. I'm saying that's there because most chiropractic physicians can get people better in a reasonable amount of time. However, there's things that they don't do well, and that's documentation, and they hear it over and over, but so many still haven't grasped the concept of documentation. And documentations means writing the right things down at the right time that will make a difference, not only in the patient treatment, but also in the litigation case, because we're involved not only with getting people better, you're involved with helping that patient to settle their personal injury case. And saying the wrong thing will destroy a case. And the documentation is tough because it's something that we think everybody knows. And often what you know, doctor, the patient doesn't know, or a jury later won't know. And so you have to explain things and explain them well through the process.
So is it okay to do your SOAP notes later in the week or later in the month after you've treated patients?
No. Let me be frank. Daily notes are done daily at the time. I've reviewed thousands of cases, mostly for the plaintiff side, and it's really obvious when the doctor takes months to produce their records. With today's technology, that's ridiculous. And that's because they haven't written them. Now they need to miss a family event, or Sunday, they have to take time off to go to the office to write things up. They just haven't kept current on their notes nor their reports. And so the case is delayed. That means money's delayed to the office. That means the patient's waiting for the documentation so their attorney can litigate. You do the notes within minutes of the patient visit, or as a standard I used in my practice, before I went to lunch or before I went home at the end of the day, all my responsibility with records were done. The only things that were outstanding were when I'm waiting for more information, like an MRI report or another doctor's opinion to come in. Then that record may wait till I get that information, but the work is done before you walk out of the office, lunch and dinner.
What's the biggest challenge you see facing chiropractic physicians who want to get into the personal injury space?
That's a great question, and that's a challenging question, partly because the challenge comes from, and I hate to be negative, but I picked up a company and created this company, Personal Injury Training, and my clients are doctors and attorneys who think they know it all, and they don't. And it's hard for them to get humble enough to realize, what they're missing. And you may be a new practitioner, graduated within a year or two, or you may be 40, 50 years in the industry. And if you can't be humble enough to learn and then, put it into practice, that's a challenge. So be humble, learn, and do a great job. And so that's the best I can give you on that question. And it's frustrating that it is a negative response, but you have to be able to be moldable and understandable. And we're doing a seminar today, and the lead attorney and we disagreed on a point, but we were able to communicate our positions so that the audience could then make a better decision on why the attorney was right in the legal world and why my comments are right in the healthcare world. And so it's just really interesting to come together. But if I said something wrong, it makes his job more difficult. Plus, he may have to spend tens of thousands of dollars on experts for something that means different to the legal profession than it means to the chiropractic or healthcare profession. And these are just normal words that we use every day.
So what would be the value then of different professions having communication and learning the situations from both perspectives?
Well, to have successful personal injury cases nowadays, we're not looking at any one health professional being a maverick and saying, I do it all, I've got it all, and it's all me. We have to know what's going on with the patient, make the proper referrals to the proper experts in other fields, and refer the paperwork properly. So if you prescribe something for somebody else to do, like an X-ray, they're obviously going to get the X-ray series, and the radiographic clinic's going to send them back to you. But if you refer for a neurosurgeon, you have to state what you want to have them look at or do. So it's a referral for an examination or examination and treatment, and refer the patient back to me when you're done. There's ways to communicate, but we have to have the experts involved. And what's interesting nowadays is they're experts. Sometimes you may not think of it like a counselor, because somebody in part of their injuries is a psychological injury. And so they need help so they can drive again, or they may only allow this person or that person to drive them, but their anxiety and their psychological issues prevent them from doing it. Or it could be pain. And so many times in chiropractic, the pain will get better as you get better. We'll work with you. And most people are doing better in 4 to 6 to 8 weeks. The pain level comes down. Well, why would you have a patient suffer in pain for days, when they could go get treatment to help with the pain while you help the physical injuries with a physical treatment and then settle it down? And I certainly understand all the complicating variables and how some pain medication can damage the scar healing process. And that's way beyond where we're going today. But people don't want to hurt today and will do just about anything not to hurt, sometimes legally or illegally. We want the patient to stay in the system and get the best care they can get at the best time. And it's a multi-professional job that needs to be done. For example, if they have a grade 5 whiplash in the Croft grading system, that means the ligaments are torn, the disc's damaged, and their spine is unstable. Well, I believe the chiropractic physician should be the front runner and the control of the case and management, and then you refer them out to a neurosurgeon to get surgically stable and have the neurosurgeon refer back for follow-up care. So all grades, the Croft Guidelines has a grading system which really helps not only into determining the magnitude of the traumatic injury, the severity, and that can lead you to what is going to be the best treatment as far as protocols go. And for example, in the state of Utah and some other states, the Croft Guidelines are the standard for the diagnosis of a CAT injury, cervical acceleration, deceleration injury, or whiplash, which I hope you don't use that words, doctors, and what is the appropriate treatment in that area. It's not a system to say, wow, I got all these visits I can do and I can make all this money with this patient. No, the Croft Guidelines are intermingled with your expertise as a doctor and the patient's response depending on multiple variables and your monthly reexaminations, and then revisit what the treatment is appropriate for that patient with their injuries. Let me bring up on another note, which is far beyond what you asked me.
Oh, keep going. This is good.
We're doing a great seminar downstairs, and what we do is we have 4 individuals that were in the same crash, and how their diagnoses and treatments are different, which also changes each litigation. And far too often I see a doctor of chiropractic that basically says, wow, 4 people in the same crash, and they come in, they all have the exact same diagnosis, they all have the exact same treatment, and that's just red flags all over the place. And the interesting thing is, if there are 4 people in a car crash, statistically, half of them would be injured. In crash dynamics and statistics and research, only about half of the people that are in a car crash are injured. The other half are injured. That's a 50-50 rate, pretty much, not going with the exact numbers, but that's the ballpark. And so each individual patient has its own evaluation, their own symptoms, and their own diagnoses with their own treatment plan. They don't all follow the same treatment plan, and that's illogical and rarely would happen statistically.
Because there's different factors for each person in the vehicle.
That's right. And that's part of what I teach is not only crash dynamics and what happens with the vehicle, I teach human kinematics in the vehicle. And it varies, and that's why the doctors have to ask a plethora of questions. Where were they looking at the moment of impact? Did they have their seatbelts on? There's just a series of questions that need to be asked. But every car crash, the vehicles are likely to have different forces, and the occupants can all have different dynamics. And I've been on cases where, unfortunately, one person is killed and the person sitting next to them needs a Band-Aid. Can't find anything else wrong with that. How does that happen? It's because each occupant receives different forces. And that also can change with the dynamics of the person. Were they hugely obese? Did they wear their seatbelt? Did they hit anything on the inside of the vehicle? There's all kinds of variables that good chiropractic physicians ask all the right questions. And those are important not only for the other doctors that are going to review a case, but also for litigation. And that also helps everybody understand the case. And the more well-documented a case is, the smoother it can go all the way around.
So you've been training professionals in personal injury since 1996?
Yes.
I believe.
That's right. And it's interesting how that started. Because I came into the state of Utah, and I guess my first awakening is when I started treating. I stepped into my dad's practice while he went and taught in Japan for 6 months. And this guy was just in a car crash right before he walked in the door. And I'm thinking, I wasn't taught any of this in chiropractic university. Nobody taught me anything. And I got my hands on this guy's neck, and I'm going, something's wrong here. And I knew the wrong was me, because I did the examination, I took the x-rays, and I did the basics, but what you would do with virtually anybody. But now we have groups that are saying you shouldn't take x-rays. Well, doctors, if you're doing personal injury and you're going to touch somebody's spine and you're going to put energy into it, you better know what the status is before you do all those things. And I've been an expert witness on several cases where the chiropractor was blamed for the injuries to the patient because they put energy into that patient's neck, but never took x-rays, never ordered an MRI, and didn't really document the case well. And so the doctor got in trouble, and the insurance company took advantage of them in a heartbeat because the doctor opened the door and let it happen. So we have to really step up our work in what we do to better take care of our patients, to better communicate what's happening with the patients, and to better treat them, as well as help them with their legal situations, because that's part of our responsibility if you're treating PI cases.
So how have you seen the landscape of PI change since 1996?
Well, I was in practice before 96, and so some of this started. And I also worked with Dad, who was a world-famous chiropractic physician, and he was an expert in orthopedics, and he was really well-known in Utah in Chicago as an expert witness. And so he was highly sought after. And so I saw things. And so in the old days, 60s and 70s, you pretty much send a bill in and the insurance companies paid it.
In a week.
Yeah, not a problem. not a big deal. And if that didn't happen,
The
the
full
fees were
bill.
different. Yeah, the full bill. And if they didn't do it, often the patients would pay it because it wasn't the kind of cost that things are today. And then all of a sudden, insurance companies got more involved. And as insurance companies got more involved, in my opinion, they've produced research that is inconsistent with good patient care, but consistent with cost reductions to these insurance companies. And I think if an insurance company is influencing the patient treatment, it's not a good source of information for that patient. And I think in my practice and what I teach others, you do what's in the best interest of the patient and you treat them anyway. I do not let, when I was in practice, people, insurance companies, someone that graduated high school, maybe went to a junior college, tell me what to do as a physician with all my work and training. It's just unbelievable. But not only that, since these techniques have come into the industry, they have now influenced the standards in some ways because people listen to what the insurance companies do and then they start doing it and then they think that's the standard and that's not. And that's another reason I'm a big fan of the Croft guidelines is they were done without significant insurance influence by a chiropractic physician that's fabulous, Dr. Art Croft, now retired, I understand. But he did that without the insurance influence, looking at over 2,000 cases to come up with the guidelines that we have and are approved in many states. For example, Utah has approved them for the third time. We're in our third decade of the Croft guidelines being the standard of care for the also standard for diagnosing cervical acceleration, deceleration injuries. And then you can come up with the proper standard of care. Now, the Croft guidelines, I think oftentimes the great chiropractic physicians that are great adjusters and healers, which most of them are, they can do much better than those protocols that are out there. So, meaning they can get people to a better level of health before they've used all the numbers that are available. But they're only available if the care is currently medically necessary and is supported by your examinations and ongoing information like the subject result. How does the patient feel? And then how is their range of motion? We don't judge results based on pain levels. When you come to this kind of trauma, we're going to judge it on what are the patient's symptoms now. Have they decreased in intensity? Have they decreased in frequency? We judge it also on what's their measured ranges of motion, because there are groups that aren't using the right tools to measure these things. And in the Croft guidelines, you have to have the right equipment, and measured results are much better than a doctor eyeballing it. Oh, yeah, that looks normal. And often the defense that comes to attack, they hire doctors, sometimes not really, they can't say what's really going on because they won't get another job. So they make up numbers to reduce this. And a lot of patients don't understand that. And a lot of doctors know that there are people that are going to reduce the care, but you have to do what the patient needs, not what an insurance adjuster or their hired guns say. Now, insurance companies also have another expert. You really didn't ask this question.
Oh, what's
They have
this?
other experts. So part of my background is I've done car crash research with a number of different organizations and actually been on the tarmac and watched some of the original work done. And Dr. Croft did some amazing work with his crash program, 1999 through 2004. I was involved in that and very supportive of what was going on. But what was interesting is people get hurt in crashes when you don't expect it. And when you're doing car crash research, we have a list of things that increase the potential for injury. And if we're not studying those, we don't want to have them in the crash dynamics if they can be avoided. But unfortunately, sometimes people get hurt simply because there was an event. And crashing events of cars has a high potential for injury. About 50%, to me, that's very high.
For heaven's sakes.
And we don't want that for anybody, but it happens. And so the doctors need to be really good and competent, even though they received no graduate training in that. You have to learn it after school, and there's all kinds of politics with the universities and why that happens. And I won't go further because it's pretty negative, but it's a real shame that our universities are not teaching the doctors how to handle traumatic cases. What tools should they use? What's the best treatment? What's the best therapies? What heals this tissue better than something else? And so that that information's available, but doctors, you got to go out and get it, like from personal injury training, so that you have those tools and can do it correctly.
Thank heavens that they can get it through Personal Injury Training Institute. And thank you for your involvement with the PIERS Association, because our values are the same, to raise the level of quality of personal injury for injured people.
Exactly. And that's why I joined PIERS originally, is because the value is there and it can help so many other people in areas that I there's so much, and I do a lot with personal injury. I can't cover it all, but I can give you a good solid foundation so you can move on to the next thing. But having this high volume of high quality is just critical. And as I just said downstairs, I said, you hear and see all these experts. So you see what Larry Lazar is doing. You hear him. Guess what? That's the deep end. And it's not in a swimming pool. It's out in the ocean. These are the experts for the deep water. And come on out and play with us. And so the reality is, and this is a real kicker that a lot of doctors need to understand, the defense insurance companies, automobile crash insurance companies, they don't have a lot to work with. And they'll attack just about anything they can. But if you understand what they're working with and what their tactics are, you can preemptively deal with those with report writing, and you can help your patient in a much more successful way than what they're currently getting. So I'm really happy to be a part of PIERS. And I'm the chairman for the education department.
Thank heavens.
And if there are questions, let us know, and we'll address those issues. Thank you.
Very good. Thank you so much for your support and for coming on the podcast today.
Thank you.